Childhood tumors are very less in number, thankfully, but it can affect, and that is a disastrous thing for the whole family because the child is less than 1 year to 3 years, 4 years, 5 years. And the commonest cancer we get in the childhood is blood cancer. We call it a CLL, chronic lymphatic leukemia. CLL, it's called as. But the only thing is, most of these childhood tumors are curable. That's the most important point you have to note. Most of these childhood tumors, if detected early, are curable, and that's why we concentrate on the childhood tumors and we can effectively treat them. And multidisciplinary treatment is the way to go about it. And effective treatment is it available? Answer is yes. Is it made affordable? Answer is yes. We are able to do that effectively, and we also have the facility for the childhood tumors to be taken care of comfortably. And we are also thinking of creating a facility for the family to stay there, because the childhood tumor takes a little longer time and the family at risk. The problem here is they have to come leave their place of work and come back, and they have to stay for months together, and that facility also we have created.
Allogenic transplantation is going to start soon. The cost, that is what somebody was asking about, the cost, and these are the two areas where the cost incurred is too much, because particularly like in the bone marrow transplantation, the post transplantations, like the patients can go for sepsis, such things like you'll be using a lot of antibiotics and a lot of things which actually incurs the actual cost. The same thing about the bone tumors. When you are limb salvage surgery, irrespective of what it is, like that prosthesis has a cost, and it will not be whether it whichever the institute, they will not cut down the cost for that prosthesis. So the actual cost of that will be around, say, 1 lakh. So here, like it's approximately between 75,000 to 1.25 lakhs is the prosthesis cost. What we see earlier, we used to amputate. Today we are going to remove the bone with the bone tumor, and we are going to use the prosthesis so that the particular patient can walk. It depends on what stage patient has come to us, and if there is no vessel involvement, all these things. But this is science. But otherwise, that particular money somebody has to pay. In Kidwai, he could create such a fund for which even that prosthesis was many times sponsored, where patients who cannot afford anything. But many of the patients in our side, like when they say the surgery is made free, but the prosthesis cost somebody has to bear it. So that is why the patients are buying only the prosthesis. But in fact, in other hospitals in Bangalore, like I say, or the many Mumbai, many big hospitals where the limb salvage surgeries are done, basically the cost of the total treatment is around, say, 10 to 15 lakhs. That is being made almost like no cost or with minimal cost. What they are paying is for the prosthesis. The surgery, if they are in the general ward, that is made almost free of cost, like in many other things.
Unlike other group, I'm happy that you are asking so many questions. I'm happy to answer you also. Even in that angle, we have thought of, and we have started what is called as innovation center in our place. It's one of the very few centers recognized by Government of India. What is that innovation center? Does it do the 3D printing of these prostheses, etc. So that the 1.5 lakhs worth prosthesis, we are able to make it at 30,000 rupees. Same quality, same titanium, because in-house we are doing it with our own technology. It will be only 1/5 of the cost. 1.5 lakhs prosthesis will come to 30,000 rupees only. So that is one another direction we are seeing. So make it as much as possible the most efficient and most effective treatment as affordable as possible. That's the aim of the whole thing.
To add to what Sir said, I'll tell with one example. These bone marrow, bone tumors are something that happens between pediatric or 16, 15 or 14-year-old boys or girls. And when they are answered to that, they have to lose their leg. It's very devastating. But we have now in our institute are capable. We have done many limb salvage procedures. As Rohan said, the cost of the prosthesis, sometimes if the patient cannot afford, we somehow get some NGOs and somebody to donate and do it. So for all BPL patients, it is free of cost. If they can't afford the prosthesis, we try and organize the prosthesis. But for patients who are coming with ability to pay. Also, the cost of this procedure is much less than what happens outside. It's just a lakh of rupees for the process is probably another 50 or 60,000 rupees for the procedure. So this is what is the cost, that is what we are giving. And in fact, our institute can boast that we did on a 4-year-old boy. It is the first case to be done in India where all institutes refused and told amputation. We went ahead and did the limb salvage procedure, and to design that process it was very difficult because it's a growing bone. We need to use an expandable process. There is a company in Germany known as Mutus, which is capable of designing that. So when we contacted them, the process's cost was 35 lakhs. Then I talked with Sir. Sir had a friend in Chennai who does these processes, and we both sat together, designed how to do these processes and sent to him. He manufactured the processes and sent us back, and it costed only 1,40,000. So this is how we are able to help people to actually make it affordable. From 35 lakhs to 1.4 lakhs was the process's cost, and his surgical cost didn't even exceed 1 lakh.